So it looks like our attendees are all here. Good evening and welcome to the APhA-ASP webinar series. Thank you for joining us for the Policy Vice President webinar. Before we jump into tonight's topics, though, we will review the basic webinar procedures. So there are two ways to listen to tonight's webinar. One by phone by clicking the Use Telephone. And then you can listen through your computer by clicking Use Mic and Speakers. So out of respect to others, to everyone on the call, everyone has been muted, so we do not have any sound issues, and we avoid hearing your dogs barking, your cats meowing, and your horses neighing. We encourage you to ask questions throughout the course of the webinar. Please do not wait until the end to ask your questions, though. We will collect them throughout the presentation and make sure that they are addressed at the end. So now to tonight's presenters. We'll hear from Keith Marciniak, the APhA Senior Director of Student and New Practitioner Development, and myself, Lauren Kirk, your APhA-ASP Speaker of the House. Also joining us are two fellow student pharmacists, Sarah Barden from Virginia Commonwealth University. She joins us tonight as the newly appointed APhA New Business Review Committee representative for student pharmacists. And she'll be chatting with us about some advocacy activities that her chapter has been doing. And we'll also be joined by Jake Peters of East Tennessee State University. Jake is the sitting president of the Tennessee Society of Student Pharmacists, and on the webinar tonight to discuss establishing a solid relationship with your state association. So we have quite a bit to cover tonight, and here's a rundown of the topics that we will be going through. But first, before we start off into those and following those introductions, we want to know who exactly is on our webinar tonight. So we'll open up our first poll, and I'll send it over to Keith to open up our first poll.
Great. Thank you very much, Lauren. For our first poll question tonight, what is your role within your APhA-ASP chapter? Chapter President, President-elect, Policy VP, State Association Liaison, Chapter Officer or Chair, or other? And we'll launch the poll right now. We'll give you about 10 seconds. 5 seconds. And we are going to close the poll there. So it looks like we've got about half the people on the call tonight are policy VPs, with 25% being presidents or president-elects, followed up by other chapter officers or state association liaisons. So great. Got a good mix of people there, Lauren.
It is quite a variety, and I'm happy to see that we have that variety because it really indicates that student pharmacists are interested in policy. And I'm glad to see that the policy VPs are in here as well, particularly because we'll be reviewing your roles and responsibilities. So the policy vice president, you are one of 9 core leadership positions of the new APhA-ASP chapter leadership structure. Formerly known as the SPAN liaisons, you are essentially in charge of all the policy and legislative and advocacy activities of your chapter. State association liaisons, they come in there too. You can either be the same person as the policy vice president or working very closely with that policy vice president. But your roles and responsibilities are very similar. So you'll stay up to date on federal and state policy and advocacy issues, communicate with the chapter, organize calls to action, and facilitate the policy process. You'll work with the APhA Political Action Committee. So it is your responsibility to understand the donation rules and manage the fundraising activities. And APhA has a number of activities involving the APhA PAC that we'll cover later in the webinar. And you'll also serve as the chapter delegate at both the mid-year regional meeting and APhA annual meeting exposition. This is really an exciting time to serve as a delegate because you serve as the voice for student pharmacists and the Academy of Student Pharmacists and really represent our profession from a student pharmacist perspective. So our next poll question, Keith, I'll hand it back over to you.
Great, and this one is for all those policy wonks out there who really understand and know the APhA-ASP policy process. So what is the name of the document that outlines the APhA-ASP policy process in detail? Is it the prescription, Rx for policy, the capsule, policy guidelines, or are we just trying to trick you and there are none of the above? We'll open up the poll now, and you'll have about 10 seconds to respond with your answer. Another 5 seconds. All right, and we are going to close the poll. So it looks like we've got a mix here, Lauren. Why don't you give the right answer? We've got 41% for capsule and 45% for policy guidelines, 10 for Rx for policy, and then 3 said none and 1 said for prescription. So what is that correct answer there, sir?
I believe the correct answer is APhA-ASP capsule, but I can understand that APhA-ASP policy guidelines is a very straightforward answer that is definitely deceiving. I think APHA chose to get a little creative there and throw in the capsule, just throw us all off. But the APhA-ASP capsule is the document that outlines the APhA-ASP policy process in detail. That can all be found on the Policy Vice President Toolkit, which we will review how to get to that capsule document later in the webinar. But as a brief overview of the APHA policy process, it starts with you and your chapter. You as a student pharmacist can really develop that initial idea. And that idea goes through the policy process. And as it moves through that, it takes the shape at the mid-year regional meeting, and then gets further developed with the resolutions committee, and it's presented at APHA annual meeting. And finally, after that, when it gets through that APhA-ASP House of Delegates, it goes to the policy standing committee, where it then becomes an implemented idea at that point. So really, again, it starts with you and your chapter. You as a policy vice president are really the steward that brings it through that process. So it is in your responsibility, and you have quite a responsibility to make sure that idea gets through the process. And speaking of MRM, I'll hand it right back over to Keith, and he'll give you a preview of this year's MRMs.
Great. Thank you so much, Lauren. We are very excited for the 2014 mid-year regional meetings that are coming up this fall. And it's never too early to start thinking about attending MRMs. I encourage every student pharmacist, and this goes for all of the chapter leaders as well as all of the student pharmacists who are members of your chapter, please, please, please attend at least one MRM and at least one annual meeting sometime during your tenure as a student. I think the true benefit of APhA-ASP really comes from attending the mid-year regional meetings as well as annual meeting. But the dates and deadlines are up here for registration. We're looking at 1 and 2, that first weekend in October, which is the 17th and 19th. MRM in Region 3 is by itself, the 24th to the 26th. 31st through the 2nd over Halloween weekend is 4-5, and then our Alliance meeting in 7 and 8. And then we're going to take a week off and then have our final MRM the 14th through the 16th of November. And as you'll see on there, the last day to register online for each of these mid-year regional meetings is about 2 weeks beforehand. It's the Friday. We usually end it at midnight, just like we do with all of our other stuff within APhA-ASP. However, Region 4, Region 3, Region 2 in particular, I want to let you guys know that we did sell out quite a bit before the MRM started last year. So I encourage you guys to register now, register early. Everything's been up since August 1st for registration, so I encourage you to do that. But as you kind of go through, especially for policy vice presidents, stay tuned to some communications, because your regional delegates will actually be conducting a webinar anywhere from 4 to 5 weeks before your MRM is going to start. And what that webinar is going to be is an opportunity for your chapter to propose 2 different policies to the group. And you'll have an opportunity as a chapter to present and talk about some of those 2 policies. And then after that, you'll have a little bit of time to maybe whittle that down to 1 policy, or if there's multiple chapters that all propose the same thing, maybe you can work with another school to kind of refine that and put that together as one solid policy. But once we kind of get our narrowed down policy, because we only do allow one per chapter, your regional delegate will resend those out to you, and you'll have those well in advance before your mid-year regional meeting. So usually a 4-week deadline, a 3-week, a 2-week, and a 1-week deadline as we kind of go into MRMs there. In addition, something new that we're going to do this year is chapters will have the opportunity to propose a roundtable topic. So if you guys are doing something innovative, and especially for PVP, something innovative related to provider status, or maybe with the election season coming up, if you guys are doing something cool that you want to spread to some of the other schools and colleges of pharmacy within your region, propose that idea, and then you have the opportunity to run the roundtable and kind of talk to the other chapter members that are within your region there. MRM 2015, we've already had a couple schools ask where it's going to be, if there's going to be any host chapter, so on and so forth. That information will be available in mid-September. We're doing a little bit of fact-finding to see where we've gone over the past couple of years, as well as what's going to make the most sense financially for the association. And then finally, got to give a plug for this. All of those students who are interested in running for regional delegate, MRMC, which is Mid-Year Regional Meeting Coordinator, or regional member at large, contact staff, contact the current officers. Their information can be found at pharmacist.com, or even contact a member of your National Executive Committee, maybe your regional liaison, and ask them some questions, what it's like to run for regional office. I can tell you from my personal experience, I was regional delegate for 2 years. I'm very involved in the policy process and absolutely loved the opportunity, and that's frankly why I'm here today working in my job at APHA headquarters. So let us know if you have questions as you kind of move through. Turn it back over to you, Lauren.
Thank you, Keith. That was quite a comprehensive and exciting review of MRM. I know I'm excited to get to MRM, and I hope everyone else is as well. So as student pharmacists, we are advocates for our patients' health. We are also advocates for our profession's future, and through advocacy, we can envision and advance the future of pharmacy. We must prepare ourselves as advocates, though. So the Advocate Training Series is a new initiative coming from APhA-ASP designed exclusively for student pharmacists to prepare ourselves as advocates. So my main question for everyone on this call tonight is, are you ready for the Advocate Training Series? And are you ready to spread the word about the Advocate Training Series? As I mentioned, the Advocate Training Series is developed exclusively for student pharmacists, and really it requires a combination of required and elective elements. It's set up very similar to the Leadership Training Series, where an APHA has experienced a lot of success and a high demand for the Leadership Training Series. But the Advocate Training Series looks to be more experiential and proactive. It is a mechanism by which you, as chapter leadership, can encourage the engagement of your members in the APhA-ASP policy process and the advocacy activities. So it really is already built into your programs, but the Advocate Training Series is a way to promote those advocacy activities. So like I said, it's a combination of required and elective elements. For instance, attending programming at APhA-ASP MRM or at APHA Annual, to engage in a Hill visit, to write an advocacy letter, or to take part in the Pharmacists Provide Care campaign. Once you've completed the Advocate Training Series, you and fellow student pharmacists can earn the recognition of APhA-ASP Trained Advocate. So the credit process really relies on the individual student pharmacist to track the details of their credit. So they will be able to provide you, as the policy vice president, all of the details for their credit. You will then collect, record, collate, and submit all the names and details for those student pharmacists who have completed the Advocate Training Series. And really, there is a lot of autonomy in the timeline of the Advocate Training Series. We recommend an annual submission from you as policy vice presidents of all of these details and the names of those individuals that have completed the Advocate Training Series. But we would request that it be done over the course of the student's membership. So again, you as the policy vice president will be responsible for collecting all of the information and the names of those individuals who have completed the Advocate Training Series. Then it will go through a review process with your advisor. You'll turn that information into your advisor or discuss it and review it with your advisor, and then you and your advisor will be submitting the information to APHA headquarters, where we will then be able to issue the designation of APhA-ASP trained advocate. A lot of the details have already been sorted out, and we have documents that are ready to go and ready to be issued out to you. They will be on the website on pharmacist.com very, very shortly. And there is a guide that is specifically built for policy vice presidents to know which details to collect from student pharmacists. Those details can include when you engaged in a Hill visit, the email address that the student pharmacist used in order to sign up for the Pharmacists Provide Care campaign. Those kind of details that would be very easily collected and very easily submitted to APHA. So those documents will be available on pharmacist.com very soon, and that will be the policy vice president document, and then there is one built specifically for individual student pharmacists where they can independently learn what they need to do in order to complete the advocate training series before submitting the information to you as a policy vice president. The National Executive Committee is extremely excited about this initiative. We are really floored that it is now launching to the country of chapters, and we're very excited to see how this takes off. So I hope you all share in that excitement and are really greatly excited about getting it out there to your fellow student pharmacists. So now that you're prepared, or once you've started working through the advocate training series, you can begin to engage in the Pharmacists Provide Care campaign. And Keith has the summary of the Pharmacists Provide Care campaign.
Absolutely. Thank you so much, Lauren. APHA has been working on this for quite a while now and invested a significant amount of time as well as financial resources and staff resources to kind of move forward with the Pharmacists Provide Care campaign to really achieve provider status for the profession. Now, first off, we're going to be getting information in emails and then Facebook posts and Twitter tweets that we want you to all send out to your members, specifically related to the campaign. A lot of the information is really going to reside within the hub, which is at pharmacistprovidecare.com. But some of the information, for those of you who came to Summer Leadership Institute, you'll know that we've got some great resources, such as the state-specific infographics. So on the Florida one there, it lists 30 of 67 counties in Florida are designated as medically underserved. We've got some great information on each state on those number of counties, which relates then to the HR 4190 bill that specifically talks about those medically underserved patients that are out there. We've got a lot of great facts and information pages that are on there and talk about the importance of why pharmacists should be recognized as healthcare providers. But there's a lot of tools that you can use. If you wanted to put a banner ad, if you want to pass out commitment cards to your fellow student pharmacists on your campus, we have those resources and information for you. We also have information on what voters are saying. So some of those leave behind that. If you have an opportunity during the election season here, visit maybe your member of Congress's local office and talk to maybe one of their staffers. And if you're lucky enough, talk to them or maybe go out and help campaign with them. But that lets them know why it's so important for pharmacists to have the ability to be a provider and to really be recognized for the services that we already do provide for our patients. But there's the making the case. There's letters that you can sign. As part of the sign-up for the overall campaign, we want students to not only register and sign up via social media, but we want you immediately to send a letter to your member of Congress. And for the majority of us now, maybe not the majority quite yet, but quite a few of you, we're now just about 100 members of the House of Representatives that have pledged to be a co-sponsor for this, which is great because actually for Summer Leadership Institute student pharmacists who went up to the Hill, we're responsible for 8 of those just within that one day that students went up to the Hill that day. So you guys really do make a difference. But sign up, share your story. If you want to provide something via video, we've got right now opportunities for you to post some videos, and as well as kind of redirect some of your students to take a look at some of the links that are up there for some of the videos that students have already posted. So there's a lot you can do. There's a lot to be done. While we don't think that we're going to make a whole lot of progress in 2014, we will get the ball rolling with the new Congress starting in January this next year and kind of take all that momentum that we've built from this fall and kind of move it on to 2015's Congress there. So I encourage all of you guys to not only be part of the campaign, but to really help your student pharmacists understand the importance of it. And that's going to be one of the major roles of the PVPs this year. So turn it back to you, Lauren. Back to PAC.
Thank you, Keith. You know, we did, and thank you, Keith, for mentioning that that student pharmacist advocating on the Hill resulted in 8 of those co-sponsors on HR 4190, because that is a great success for student pharmacists in advocating for our profession. And there's also a great way for us to further get involved with the Back the PAC campaign. This is a national advocacy campaign, or the goal of the Political Action Committee is to protect and promote the profession. It supports national candidates for federal office who have demonstrated support for pharmacy issues and recognize the value of pharmacists in healthcare. So it really gives pharmacy a voice. And the Back the PAC Challenge is supporting that voice. It's an annual fundraising challenge to support the Political Action Committee, just as it sounds. There's a competition between chapters as well to raise the most funds for the APhA Political Action Committee. And really the top 5 fundraising chapters will be recognized at APhA 2015. Last year we had 22 chapters compete in or participate in the Back the PAC Challenge, and they raised over $15,000. And this was involving new practitioners and alumni who either matched the student pharmacist contributions. What's really exciting about this year is we've revised the timeline for the Back the PAC campaign so that it's not just between January and mid-February. You all, as policy vice presidents, can begin to participate in the Back the PAC Challenge now. It is now a year-round campaign that you can become involved with, so that it's not restricted to a month. Again, you all can participate in the Back the PAC Challenge and begin to organize fundraisers now, and they count towards the Back the PAC Challenge that is awarded at APhA annual meeting. So as we've mentioned, we've highlighted some, very vaguely, we've highlighted some of the participation student pharmacists and the successes that student pharmacists have had in policy and advocacy initiatives. And really, there are some great success stories across the country, and really what we're looking to do tonight is spotlight a chapter. Virginia Commonwealth University has definitely been doing a great job there in Virginia in making sure that student pharmacists have a voice, as well as protecting the profession through their advocacy activities. So at this point, I'd like to introduce Sarah Barden. She is here to join us and tell us a little bit about the Virginia Commonwealth University advocacy initiatives. So Sarah, I'll turn it over to you.
All right, thank you, Lauren. Like you said, my name is Sarah Barden. Last year I was the policy vice president at my chapter, and I've also been involved in another organization that started at VCU called the Student Pharmacist Policy and Advocacy Forum, otherwise known as SPAF. This organization was actually started in the 2011-2012 school year when I was a P1 by 3 students who really wanted to make a difference for policy and advocacy, and to make that something that was accessible to all students. So sort of the way the organization has evolved, it's been led by the APhA-ASP student chapter policy vice president since it started, but it's open to students who are in any student organization or even none at all, and we don't charge any sort of a membership fee. We really focus on having our meetings be interactive, so they're not didactic, they're not lecture-like. We try to have group discussions about things that are important to the changing healthcare environment and to the public health landscape. Sometimes there are pharmacy-specific topics, such as talking about pharmacist or technician scope of practice, and sometimes we're looking at broader issues like what kind of healthcare policies different candidates for office hold, so that we can start discussions and try to talk about, you know, what really works for the state of Virginia and nationally when those things come up. We've also taken ownership of preparing students for legislative days that we have at our state capitol. And we do those with both the Virginia Pharmacists Association and the Virginia Society of Health System Pharmacists. They have 2 separate legislative days in Virginia, and so we work with students to prepare them so that they feel like when they go in and actually meet with their representatives that they're confident and they know the topics that they're going to be talking about. So we had such good success with our students at VCU that we really wanted to try to share what we've been doing and to make that available to other students across the state of Virginia. So we came up with wanting to have what we called the colloquium. And this was about 2 years in the making from the time that we had the idea to actually being able to implement it and make it happen. But what we wanted to do was to bring students from all 4 schools in Virginia and from schools in Maryland together for one conference. And so what we did was we partnered with the Virginia Pharmacists Association at their mid-year meeting, which was February 24th of this year. And we had a day-long seminar where we talked about multiple different policy and advocacy topics. So we really wanted to encourage student engagement in policy and advocacy discussions and really talk about, what are the challenges and opportunities that the different schools in our state and in Maryland were experiencing. How could we learn from each other? What were some schools doing that were working really well, and how were they overcoming other challenges? And we wanted to give students a chance to actually participate and, have active involvement in practicing some skills that then they could take back and go and use back in their states. So one of the activities that we do is we bring in faculty members or leaders in the pharmacy associations, and we have them serve as mock legislators, and then we give students the opportunity to prepare talking points and then actually present those talking points to the mock legislator and then get feedback. So it's a learning process for the student, and they get practice, so then when they actually go and meet with their actual legislator, they feel comfortable about the topic that they're doing and also in how to approach and go about interacting with them. We were really fortunate this year that there was a guest speaker, Rear Admiral Scott F. Giberson, who's the acting Deputy Surgeon General of the United States and a pharmacist, who came and gave a special guest lecture, and so our participants in the colloquium were able to attend that lecture as well, which was very exciting for everyone. And just wanted to mention a little bit about how the colloquium was structured. We received a grant from the Harvey F. Morgan Institute for Policy and Institute for Government and Public Service. And this was an association or an organization that was started by VPHA, and they work on the state level and everything, doing policy and advocacy initiatives, and they were generous enough to give us funding to allow us to put this colloquium together. And we were able to have students and faculty members from 6 different schools, all 4 in Virginia and 2 in Maryland, and we really got to come together as students to talk about policy and advocacy issues, and it was very well received, and we're really looking forward to planning the one that's coming up this year. So Lauren, I'm going to turn it back over to you. Thank you.
Thank you very much, Sarah, and great work there with VPHA. It's really an example for all of us to look to and follow as an example. So our next step, we'll step into hearing from Jake Peters, who again is the president of the Tennessee Society of Student Pharmacists. So Jake, I'll hand it over to you.
All right, thanks, Lauren. So as Lauren said, I'm Jake Peters. I have the pleasure of serving as the Tennessee Society of Student Pharmacists president this year. And just a little bit of background. I won't get into all the nitty-gritty details of how our organization is set up and everything, but it's really important to highlight that as a student organization that functions underneath the umbrella of the Tennessee Pharmacists Association, that we actually function as one unit. So in the state of Tennessee, we have 6 colleges of pharmacy that span across 8 different campuses in the state. So we have a lot of devoted and ready-to-go student pharmacists that want to make an impact in the profession on a number of different levels. So tapping into those resources has been very successful for us, and specifically I'm going to talk a little bit about some of the policy actions that we have had over the past year. If I can get my mouse to work here. There it goes. All right. So first and foremost, when we're looking at getting involved with your state, especially on the policy end of things, you have to answer the question why it's important. For those of us that have been able to make a Hill visit, which I hope that the majority of us on this webinar have or are planning to do so, we always have to prepare ourselves for the why question. So when you go in to ask a legislator to support, whether it be provider status or whatever pharmacy issue that we're in there discussing with them, we have to be prepared to not only ask them for that, but also have our reasoning as to why they need to be a part of that. And the same is true for engaging student pharmacists in your chapters and across your state to do that. So the first thing I always like to highlight with those student pharmacists when talking with them is that state policy often affects our day-to-day practice. For those of us that are third and fourth year students that have our board exams lingering on the horizon, we know that not only do we have our national law exams, but we have our state law exams. And a lot of those state-specific policies and laws are what dictate what we do every day. So being able to be a part of that process, having our voices heard so that we're able to regulate the profession that we practice appropriately is critical to the functioning on the state level. Secondly, as many of us can probably think of several people on our campuses that maybe are from a different state. So they may wonder why it's important to be involved in a state association. This may not necessarily be where they're from. And the most important thing to highlight there is that the experiences that you gain will translate to whatever state or wherever it is that you end up. The photo that's right there on the slide, there's 7 student pharmacists, and not only are they just happy and excited to be on Capitol Hill in Tennessee and Nashville, but at least 3 of those, I'm positive, are not actually from the state of Tennessee. But they decided to take those experiences, gain those while they're here, and then whenever they go to wherever it is that they end up, it will, as I said, translate to being effective in the policy process in that state. And we can also, if we've heard it once, we've heard it 1,000 times, that pharmacy is a very small world. So as we see kind of things snowballing, we see states like California as they pass provider status laws, and other states starting to put the ball in motion for their own provider status laws. Being able to be a part of that process and start to realize the ways that we can be involved are absolutely critical while we're still in school. And lastly, it's important to remember that our input is essential in the successes of our state association. And that leads me into a success story of what we were able to accomplish this past year with the Tennessee Pharmacists Association as our student organization of TSSP, aiding in the process of passing collaborative pharmacy practice. As the president of our organization, I'm allowed to sit on our board of directors. And last fall, when the idea was entertained and we started putting together the process by which we were going to pursue collaborative pharmacy practice, I immediately decided that this is something the students need to be a part of, and started approaching different student pharmacists across the state to collaborate together to start getting our own campaign of support to go along with this. So as we did that, some of the things that I'm sure several of us have done, but we were able to put together our own letter writing campaign to send out to legislators. And not only just putting together a stock letter that student pharmacists were able to put together, but we also put a little personal touch in there. So student pharmacists were able to highlight a reason why collaborative pharmacy practice was important to them and why it was important to the patients of our state. So they could put things in there such as even something simple like Mrs. Smith came in the drugstore today and we noticed a drug interaction that she had and we were able to fix that. Things like that that our legislators probably or may not necessarily be aware of that pharmacists are able to do on a day-to-day basis. So doing things, putting that campaign together was important. We were able to submit 503 letters across the state to our legislators. And for a little bit of perspective, we have 99 members in the House and 33 in the Senate. So by the law of averages, as I'm kind of calculating this roughly in my head, each legislator received about 4 letters from student pharmacists. And I think that was a really pivotal piece to the campaign and its success over the past year. And also, you know, we were able to put together a Hill visit. So in February at our annual meeting, student pharmacists got together. We went and visited our legislators. We camped out on Capitol Hill and did a little bit of a health fair to raise awareness about the services that pharmacists can provide. And really we're able to start developing the relationships that not only served us well in this campaign, but surely will serve us well as we move forward for other pharmacy-specific issues. So just with speaking to that and thinking of the ways that we can be involved in our state associations, I encourage each of you guys, if you're not plugged in with your state associations, go back and get those contacts. You know, start looking it up on the internet and finding ways to get in touch with the staff and the executive committee of your different state associations, and figure out ways that as student pharmacists you can support their campaigns. Because as I said, our input's essential. We bring a really great piece to this as far as motivation goes, as far as really speaking towards the training and the desire that pharmacists have to be a part of providing great patient care. So I just encourage each of you guys to do that, and then I will turn it back over to Lauren.
Thank you very much, Jake. I think your point about getting in touch with your state association to get involved with their campaigns in order to provide our input is an excellent message to send to our policy vice president. So thank you very much for joining us tonight, both of our guest speakers there. So at this point, we'll move into reviewing the policy and advocacy resources. The hub that we will focus on is pharmacist.com. Pharmacist.com has a number of resources, and sometimes it is admittedly difficult to breeze through, but it's all there. Those resources include the policy process resources, the policy vice president, monthly Sparks, and the Sparks are student political advocacy resources and communications. The policy standing committees, this policy standing committee serves as a resource as well as the regional delegates. So there are an immense number of resources available to you as a policy vice president, and you are not alone. There are a number of student pharmacists across the country that are working towards these same initiatives. So not only are these resources for you, but your fellow student pharmacists are also resources for you. So we'll step our way into pharmacist.com and begin to explore a little bit. But the major heading there, once you go to pharmacist.com, click on Get Involved, and you can see noted there on the main page is provider status. Clicking on that link will definitely lead you to the pharmacistprovidecare.com campaign. But for this illustration, we'll click on Get Involved and step then to Participate in the House of Delegates. This will take you to the main page for the House of Delegates, but what we want to focus on is the student pharmacists and what is the APhA-ASP policy process. And that will give you more details as to what exactly and how you can get involved in the policy process. And really what it'll then link you to is the APhA-ASP Policy Vice President Toolkit. The toolkit has a number of resources for you that will cover here by going through a different way. You can click on that way, or you can go back to the Get Involved and then the APhA-ASP link there. And then we'll step into finding the APhA-ASP chapter resources. And that then will bring you to the next page, which is focusing on the section of policy and advocacy development. And this will be another hub for you as policy vice presidents and chapter presidents, where you'll be able to review the policy process, you'll be able to access the policy vice president toolkit, you'll be able to access the Sparks from the policy standing committee, and you'll be able to find out about the policy postcard challenge. But what's most definitely the the gemstone of the policy resources is the Policy Vice President Toolkit. And I'm very pleased to say that the Policy Standing Committee has worked very hard over the summer in order to make sure that this is new and updated specifically for this year. So we've not necessarily changed the format, but we've been able to update all the documents so that they are current and with all of the correct information ready and waiting for your consumption. So the Policy Vice President Toolkit, it includes sections about advocating for your profession. It includes an entire section about the American Pharmacist Month, APhA-ASP awards relating to policy, and a lot more detail about the Back the Pack campaign. So really anything that we have covered throughout tonight's webinar will be available within all of these resources. Like I said earlier, there are an immense number of resources available on pharmacist.com. But if you can't find the information on there, contact one of the Policy Standing Committee members. We have Dylan Jones as the Vice Chair, Valerie, Sarah, and Sierra all sit on that committee, and they are highly engaged students that are working to review the resolutions passed by the APhA-ASP House of Delegates, and they take action to implement those. So this crew, like I mentioned earlier, has reviewed the Policy Vice President Toolkit for us, and it's ready to go. Also a resource are our regional delegates. All of those there, you'll find your region and then your respective regional delegate. They will be your first access point for you as a chapter policy vice president. You'll be able to chat up with them, and they will really be a liaison from APhA-ASP staff and the National Executive Committee to you as a chapter member. They're definitely a resource that can connect you with other resources and most certainly be able to answer your questions. So I'll turn it back over to Keith from some updates from headquarters. So Keith?
Thank you very much. This is our paid sponsor section here of the webinar. I want student pharmacists to get involved with the APhA Foundation, and there's I'm only going to highlight 2 ways, but there's many ways to get involved, and I highly encourage every student pharmacist to go to the APhA Foundation website, which is www.aphafoundation.org. But 2 things I wanted to mention tonight are the Student 1953 Society, which is a program that the pharmacists currently do, but pharmacists will donate $1,953, whereas we're looking for students to donate $19.53 to the APhA Foundation. And we're going to have those students recognized as a member of the Student 1953 Society. And then they'll also have all of their donations go directly to APhA's Foundation's Student Scholarship Program. So that's one of the ways to get involved individually and have your individual members get involved. And then the other way to do that is through APhA's Pharmacist Care Campaign, not to be confused with Pharmacist Provide Care Campaign. But what it is personalized signs that are on the headquarters, APhA headquarters lawn, which kind of sits right there in the corner of 22nd and Constitution, right across from the Lincoln Memorial in Washington, D.C. So for a week or so during American Pharmacist Month, pretty much everybody who goes by will see pretty much hundreds of signs out there supporting the professional pharmacy. And as you can see there, there's the California Pharmacists Association. So those are 2 easy ways to kind of get involved. In addition, we want to get more student pharmacists involved with some of the activities that we do for Joint Forces, which is basically a seminar. It's called the Joint Federal Pharmacy Seminar, which will be held in Washington, D.C. It's October 19th through the 22nd this year. And their mission is to provide education and training to kind of bring value to the federal pharmacist members that are out there. And as you can see, it involves those from the Veteran Affairs, the United States Public Health Service, Army, Navy, Air Force, and Coast Guard. And student pharmacists are invited to attend the Joint Federal Pharmacy Seminar this year to learn more about the federal pharmacy sector, to really network with the pharmacists who are currently practicing in those areas, as well as kind of figure out if this is a good career path for them. So there is special pricing for student pharmacists. If you're maybe in the Virginia, Maryland, D.C. area, maybe as far as Jersey, Pennsylvania, North Carolina, that sort of thing. If you're interested in attending, we do have rates for one day, or if you want to attend the entire meeting. It does fall from Sunday through about Wednesday there. but I've asked actually that the majority of the student programming be late Sunday night and then early on Monday morning. We're going to have our keynote speaker, and kind of after that there's more expo and stuff. So if you can do like maybe Sunday night or early Monday, you'll actually get a good experience kind of moving forward there. And then finally, we want to continue to promote Facebook, Twitter, as well as the APhA-ASP YouTube page. So we encourage you to join our national Facebook account. That's the way we're going to send out a lot of information over the next couple months regarding MRMs, American Pharmacist Month, and physician-specific information. Our Communications Standing Committee, headed up by Brian Donahue, APhA-ASP National Member at Large, does a phenomenal job on making sure that everybody's fully aware of what's going on within the profession. And they also do a great job with our Twitter account as well. So that ends our portion of the webinar tonight. We would love to answer any of your questions that you have for the next 12 or so minutes here. And the way that we do that is we have everybody type in their questions, and we'll kind of read them aloud and try to answer as many as we can. We've got actually quite a few thus far. So the first one is from Drew Register. Drew writes, Lauren, is the Academy planning to continue the Policy Postcard Challenge initiative this year? If not, is it okay for chapters to use the template from last year if they would like to continue participating? So I'll throw that one out to you there, and I can help as well.
Very good. Drew, I think that's an excellent question regarding the Policy Postcard Challenge. It will be, we will be conducting that initiative this year again, and all of those resources, like we mentioned, are available on pharmacist.com within those policy and advocacy development resources. And really that, we didn't necessarily review all of those details on this webinar simply because we had so much to get through, but that postcard challenge will be going forward where you take those postcards to patient care projects or out into the community where patients write a testimony about how student pharmacists have affected their health or how they have been able to affect their lives and provide care to those patients. And ultimately those postcards are sent to legislators. So at the end of the year, we calculate how many your chapter has sent off, and that becomes a competition. Whoever or whatever chapter sends off the most postcards is awarded and recognized at APhA Annual. So Keith, do you have anything to add? I guess Keith doesn't have anything to add. So
I've been talking there on mute the entire time. Sorry, Lauren. No, I thought you did a great job, and it just comes down to we had so many things we wanted to cover tonight that was one of the things that was left off there. But continue to check the Policy Vice President Toolkit for more information related to that. So Sarah Barden, if you wouldn't mind unmuting there, this question is for you. The majority of my chapter thinks that they aren't policy people. How do I change that thought process?
That is an excellent question. And I'll tell you, it's a challenge. When we had our colloquium, that was one of the things that we heard from pretty much most of the schools. I think one of the things that has worked for us is because we have the policy forum, and it's basically just a group discussion. So we get food, bring everybody in for lunch, feed them, and we just talk about it. So there's no pressure. We're not asking them to go immediately and talk to representatives or anything. We really just start that dialogue and having a discussion with them, and so it becomes something that is more accessible. I think sometimes there's a lot of fear around the words policy and advocacy because people think politics. So we work really hard at trying to draw a distinction between what those words actually mean, and that we're not asking them to represent any political party or anything like that, that we're really talking about, how do we have conversations with the people that make the laws that affect pharmacy practice. And I think when they start seeing that it's not scary, that it's not political, that they get on board a little bit easier. I hope that helps.
It does. And then we have a follow-up question for you as well. It said, should I write my legislators where I go to school or where I grew up or just where I'm registered to vote? What did you guys do in Virginia when you kind of worked through your process there?
So typically we have students write to the people from where they vote. Because that's actually, where you're considered to be a constituent, and when you're speaking or talking to a legislator, they tend to put more value on the things that are coming from their constituents. Having said that, we've had pretty good reception just because of the fact that we're students, and so they seem to be impressed, at least at the state level, that we're taking the time, as students to become actively engaged in our profession, and so I think you can kind of leverage that a little bit more as a student so that it doesn't matter quite as much as, maybe when we actually become practitioners.
Great, good answer. I would agree with all that. So Jake, give me a second here and then we'll unmute you because I know you have a little bit of feedback. But the question kind of relates again to letter writing campaigns. Should we use a pen-written letter with areas for them to personalize, or let our chapter members have a go at it themselves? What did you guys do in Tennessee?
So in Tennessee, we developed a stock letter. So we put in there, we worked, as I said, very closely with the TPA and kind of developing our information and the things that we wanted to convey to the legislators so that the information was consistent across everyone contacting them, whether it be student pharmacists or practicing pharmacists. But we did, with that handwritten letter and that personal touch that I mentioned, just leaving a space in a Word document so they could just add in a couple lines there, just like I said, to put in that little bit of a story or reasoning why it's important to them, so that legislators, if they're receiving hundreds of letters, there's a little piece of it that maybe will catch their eye that's a little bit different with each letter that they do receive. And also, I'd touch a little bit on the previous question that was asked about writing letters, whether it's from where you're at school or your original, where your address is. Legislators, while they look at the address, they're really, one of the things, we had an advocacy session at our recent TPA annual meeting, and one of the things that was shared with us is that legislators are really keen on any connection you have to their district. So even if you work in a different town that you maybe don't go to school in or don't live in, your legislators are really, they know that by way of just working there, you have a way to be in contact with their constituents. So you may not actively vote for them, but you're going to be interacting with people that do. So they don't think that they won't hear you out for that just because your address is different. If you can find a way to connect yourself to where they're from, you can be a really an important asset to them.
Great, thank you very much. All right, this is for Lauren. The question is from Benjamin. What is the best way to make a policy meeting appealing to my fellow students?
Well, thank you, Ben, for the question. I know we always laugh, but I believe food is always an attractive element to make a meeting very attractive to student pharmacists. But in addition to that, or in substitution for that, I would definitely encourage you to consider what is appealing to student pharmacists and really look at and really reinforce that the future of pharmacy is dependent upon their careers and their involvement. And our input at this stage within our careers is definitely is certainly needed. So I would reinforce the need for student pharmacist input in the policy process, and really try and engage them by finding ways that they can relate to policy and understand how their input can affect policy.
Great, thank you very much. And kind of a follow-up to that, I'm going to pass this one to Sarah. A student writes, Nick Lawson, for myself as a new policy vice president, what is your #1 suggestion to get a chapter going related to policy issues and preparing for my first MRM? Any P4 words of wisdom there?
Ask your members, your chapter members, what they care about. This really, speaking to what Lauren was talking about just a moment ago, they have to have that personal connection. So, figure out, do you have something going on in your state that really, that people connect to? Is that something that is possibly also a national issue? I think it really is trying to connect to what matters to them, because then they become excited about it and then they want to advocate for it. People who are salesmen are really good at selling things that they think are valuable. And that's essentially what we're trying to do with this, is we're selling our profession, we're selling whatever our ideas are. So figuring out what it is that they are particularly interested in or what they think is really important about being a pharmacist or what's going on with pharmacy practice, I think is probably the biggest key.
Great, good answer. We have a couple questions related to the advocate training series, Lauren. And they relate to some specifics, but the first one is in regards to P4s. Maybe retroactively, have things been done during the past 4 years? Can you count them from now, or are you just from the past, or are you only doing this from now moving forward?
Well, to mention, again, a lot of the specifics will be issued out in those guidance documents that will be available on pharmacist.com very soon. But to answer that question specifically, unfortunately, at this point, the fourth year or final year credits will not count towards the advocate training series. Anything from this point forward will certainly count towards that, and we would encourage you to continue the pursuit of the advocate training series by engaging in it from this point forward.
Great. And a follow-up question in regards to that is, what if you can't make a visit to Washington, D.C.? Is it okay to meet with your local legislators? And how do you mark that on your forms there?
Another great question there. Advocating for the profession is really what the objective of the advocate training series is. So whether it's a visit to your legislator in their home, whether it's a visit to your legislator in a state Capitol Hill, or on the federal Capitol Hill, those count towards the advocate training series.
Great. And then a final question related to the advocate training series. Are we counting as APHA if you go on a Hill visit to Capitol Hill through another pharmacy association, such as NACDS? They do a fly-in day along with NCPA in the spring. Does that count?
It certainly does, Keith, and to whomever asked the question. Again, you are advocating for the profession, whether it be through APhA-ASP, whether it be through your state association or another pharmacy association, you're advocating for the profession, and that's certainly commendable and what should be awarded through the advocate training series.
Great, thank you very much. So we've actually reached our time limit here at 10:30. There's a couple questions that are in the queue. They're more specific, and what I'm going to do is pass those along to Sarah and ask that maybe she round back with everybody via email there. But one question
Absolutely.
came through. Yeah, one question came in regarding the PAC and how you can collect money. You can pretty much collect funds any way you want through the PAC. However, there are very specific federal laws related to who you can solicit funds from and how you then record that information. So if you want to just, say do a collection plate very similar to what you would do at church, that's often not the best way to go out there and do that, because you do have to record who provided the funding to you and supply that information to APHA. You also can't solicit PAC funds, say, from non-members. It can only be a member solicitation. So, during your organization drives during the first week when P1s come in, or, during your first general meeting where half the room are not members, you can't actually go out and solicit funds for the APHA PAC. It's one of those federal election type laws that we have that are out there. So, but I thank everybody from APHA Student Development staff's end, and thank you for Sarah and Jake for participating tonight on the webinar. And we'll try to do our best we can to email some of the questions. I do want to also let people know, we've got this question multiple times, this is being recorded and we will post it on the YouTube page as well as pharmacist.com by the end of the week here. So give it a close there, Lauren.
Well, thank you, Keith. We reviewed quite a bit of information tonight, and like Keith mentioned, it will be posted. But again, we have a number of resources available to us as policy vice presidents and chapter leaders. And really, we're all points of access and resources for one another. So if you have any other questions, please feel free to contact anyone regarding your question. But thank you very much for joining us for the APhA webinar, ASP webinar series tonight and the Policy Vice President webinar. We really appreciate your attendance and your engagement in not only the chapter leadership, but also the profession. Again, as we go forth from tonight, I encourage you to engage not only yourselves in advocating for the profession, but set a goal to advocate, to help others advocate for our profession. So with that, we'll sign off and look forward to interacting with you all throughout the rest of the year.